Good evening to you viewers, wherever you're joining us from around the world. Welcome to your favorite medical show, Ask Dr. Saw. As you know, we come weekly on TBN's platforms, the Guyanese Critic platforms on Facebook and YouTube. And we come to you every Tuesday night at 8, bringing to you the information that you need to hear about your health. Joining us from England is the man himself, Dr. Saw, who makes this show possible. Dr. Saw, good evening to you.
Good evening, Akash. Yes, thanks again for being here.
Wonderful. Doc, last week's topic that we dealt with, migraine, was very engaging with our public and with the viewers, and I'm happy to see people coming out and having these discussions and sharing their own experiences in many ways. Because by sharing their experience, someone can understand that, hey, this is a symptom that I'm having also. So viewers, I really want to thank you for your engagement. You know, we have some of the most amazing viewers and followers on the show, and we really want to thank you. This evening, our topic is on anemia, and I recently met someone, Doc, who suffered, who went to the doctor because she was not well and she had some physical symptoms showing up, and she said it was anemia. I'm going to talk to you about that a little bit later. But Doc, this evening, tell us, what is anemia?
All right, so we know most people at some point in our lifetime, we always do blood tests.
Yes.
And part of the blood test panel, you will get your blood checked, which is called your full blood count, and that shows something called your hemoglobin.
Mm-hmm.
Now, I will give you the definition of anemia, and then I will explain it for the viewers to understand a bit. So hemoglobin, so the definition of anemia is the reduction in hemoglobin or red cell mass. So you know the blood, so the reduction in hemoglobin or red cell mass, they are, similar. So our body has got a red blood cell and white blood cells.
Yes.
So the red blood cell has got something in it called hemoglobin.
Mm-hmm.
And when that hemoglobin is less, and there is less red blood cell, the quantity and less of mass of the hemoglobin, that is defined as anemia. And there are cutoff limits. So for men, average is about 13. So this is very important to grasp. Because I see patients come in and say my blood count is 13, and one says it's 130. So when the unit that is used is what determines if it is 13 or 130. So for men, they say if it is less than 13,
mm-hmm.
is anemia, and that is 13 gram per deciliter. If you go gram per liter, you just multiply by 10, because 10 deciliter is equal to a liter.
Yes.
All right, so this is a big confusion with people, because even a couple of days ago, a patient came to me and said, Doc, the nurse said my blood count is about 120 something, and I know you used to tell me it's 12 and 13. Mm-hmm. How it becomes 120 something? But it's just that the lab, they use different units.
Oh,
so
okay.
You just got to understand, if it's 12, that is equal to, just multiply by 10.
Mm-hmm.
So it's gram per deciliter, so 12 gram per deciliter, or you can express it as 120 gram per liter. So they're the same thing, but it's just the unit that is used. Right. So internationally, lots of places, they use cutoff for men as 13 or 130. And women cutoff is 12 or 120. In pregnancy, it's a little bit lower. Cutoff is 11 or 110.
Okay.
Right? So if your red blood cell, if your hemoglobin drops below that, that's the definition of anemia. So, okay, let us talk what is hemoglobin, because it's confusing, people don't understand what is hemoglobin. So what's the relevance of all of this?
Yes.
So I said to you, our body has got our blood is made up of red blood cell, white blood cells, protein and liquid, all of that is in the blood, right? But the red blood cell carries oxygen to our cells. That's the purpose of the red blood cell. It carries oxygen. And as you need oxygen, all your cells need oxygen, your brain, everywhere needs oxygen. So the red blood cell has got something called hemoglobin in it. And that hemoglobin is made up of iron and other protein. So the hemoglobin is made up of iron and protein. It is in the red blood cell. And as the red blood cell circulates, it traps the oxygen and takes it around the body. So that is the relevance. So if you have low hemoglobin, you can have low red blood cell, that is a low blood cell count, or low hemoglobin. You have less oxygen going around your body. Simple as that.
Wow.
So that's your definition in a very, I'll try to explain it as in layman's term for everyone to understand.
I know, Doc. While anemia might seem like just a small topic, it's very large, because I've been checking in to see, checking up online to check on this, and I'd realized that there are various types of anemia, and what of the various types of anemia, which let me call those out for you here that I have. Aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, and vitamin deficiency anemia.
Go through that.
Yeah, which are the ones that more commonly?
You get tons of different types. They have microcytic, macrocytic, normocytic, hemolytic anemia, autoimmune anemia, sideroblastic anemia, thalassemia, sickle cell anemia, all these conditions. So we have to see anemia as not actually a diagnosis. Yeah, there is a diagnosis, but actually as a reflection of something else happening in the body.
Right.
And it then fits into a category.
Yes.
So it's like if you have fever, we are looking for the cause of the fever. So similarly, you have anemia, we look for a cause and see which category it fits in. So there are different classes or different types of anemia. And the relevance is, I'll tell you the relevance. Why is anemia important? Obviously, I just said to you, the anemia is important because the red blood cell or the hemoglobin transport oxygen. So if you don't have enough oxygen in your body, you can die eventually. And because that's the whole point, why we breathe. We breathe because we get oxygen.
Yes.
And if the oxygen cannot move around the body, then we'll die.
That's right.
So it's a very serious thing. But the thing is, it is so common. When you said, okay, it's a small topic, actually, when they look at the prevalence of anemia, they say around the US, some stats show that in the population for men is about 4%, in women about 8%. And there are some studies have shown in hospitalized patients, they did a study which shows that hospitalized patients going for heart surgery, their prevalence is about 50%.
Wow.
Close to half of those patients are anemic. We know hospitalized patients, indeed, half of them are anemic. So it's a very large population of people. And I would say, even the stats, if you say for women, 8%, I know for a fact, in my cohort of patients that I've seen, women who are menstruating, so that is premenopausal and after menarche, that is when your period starts, I would say close to half of those population of people would have low iron, which can give rise to anemia, and ever so often they're anemic, on and off, because it has to do with how much you're bleeding, because bleeding is a cause of anemia. So, and then I want to distinguish the difference with low iron and anemia,
right?
Because there is always this confusion. So I will come back to that. Let me just talk a little bit about the different types of anemia and how do you know which type you've got.
Exactly.
So logically, the red blood cell has got hemoglobin in it, and it's made up of an iron. Hemoglobin is made up of iron. So when we look at our body makes red blood cell. Red blood cell is produced in the bone marrow. So in that marrow of the bone, you produce red blood cell. Now you need certain components to produce red blood cell. So there's some chemical needed, like there's something called erythropoietin, produced by the kidney, that control the production. And also you need some nutrients. So you need vitamin B12, you need iron, you need folic acid. So you need stuff to produce. So when patients say they're anemic, we need to find out, are you anemic because you're not producing enough? So we can divide it up like that. It's very simple. So just to have a simplistic way of looking at it, we can say, all right, you're anemic. All right, why am I anemic? I can be anemic because I'm not producing enough. And we can look at why do you not produce enough? Then we are anemic because you're producing it, but it is being destroyed. So we call it destruction of the red blood cell. We call it hemolysis, right? Or you're producing it, it is not being destroyed, but you're losing it. So you're bleeding.
Right, right.
So those three categories, if you understand those three categories, you'll understand anemia in a better way. So whenever somebody says you're anemic, say, Doc, is it because I'm not producing enough? Is it because I'm producing it but it's broken down and it's destroyed? Or is it because I'm losing it, it's bleeding, I'm bleeding somewhere? So those are the three fundamental questions you will ask, and that can give you an idea as to what is causing your anemia.
Right.
So that's a very...
Yeah, sorry, but Doc, when I first heard about anemia and people being anemic, the first thing that is associated is that you don't get enough food to eat, or you don't get food to eat, and you're anemic. Or you don't eat properly, right? So it's always you spoke about nutrition, but most of the time when you hear about anemia, it's always associated with one's lack of having proper meals and nutrients. Yeah.
Right. So that is I've just explained that is one cause, because I said that would lead. So you're producing it now. So what I need to produce something, I need the ingredients. So food is important. You need iron, you need vitamin B12, you need folic acid, you need some chemical in the body.
Mm-hmm.
So if you have a shortage of that, you can't make it. You need the ingredients to produce it. And then you need the apparatus, whatever is producing it, got to work well. So if I'm baking, my oven got to work.
Right,
There's no point to put all the ingredients together and the oven is not working.
Yes, yes.
So likewise, in production, so that is a production reason. So when you look at it, you'll say, okay, people who are low in iron, patients who, so it's producing the bone marrow. So if the bone marrow is not working, then you can't produce enough. Now, that aplastic anemia, one of the types of anemia, it is because the bone marrow cannot produce it. And now we ask ourselves, why am I not producing enough iron?
Right.
Why am I not producing enough hemoglobin to raise my level of hemoglobin?
Yeah.
Or red blood cell? Why am I not producing enough? And there are various reasons. So that category could be aplastic anemia, the bone marrow is not producing enough. You can have kidney failure, where the kidney got to produce a chemical that control the production. So that can cause it. You can have conditions like certain chemical in your body. So let's say some poisons, venoms, poison chemical to use like insecticides, chemical to use in plant, they can destroy the bone marrow production.
Okay.
And you can have some infection, like viruses, can destroy the bone marrow production. And then you can have cancer of the bone marrow. So people who have leukemia, lymphomas, any type of cancer, because the bone marrow is producing red blood cell, it also produces white blood cell, it also produces platelets, which to do with clotting. So if you have a cancer, let's say you have a white blood cell cancer, leukemia is a white blood cell cancer. So the bone marrow started produce too much of that. And what happened? It started producing less of the red blood cell.
Right.
So that can give rise to anemia.
Mm-hmm.
So that's a production cause of anemia. And when we look at the destruction of red blood cell, you have that hemolysis. It can be destroyed. So when we talk about sickle cell, thalassemia, and those conditions, these conditions we are born with. So people can either born with a full disease where they have all the genes for it, or they have half of the genes for it, and we call that a trait. You're a carrier. So people who have got, let's say, thalassemia trait, they probably would just be mildly anemic and they live normal lives. Mm-hmm. People who have got a full thalassemia disease, they have a full-blown condition where their liver is enlarged, their spleen is enlarged, and their life expectancy decreases, and they need regular blood transfusion because the blood is destroyed. So when you have sickle cell, similarly with sickle cell, you could either have a sickle cell trait or you have a sickle cell disease. So when you have all the genes for it, you have the disease or you have the trait. So depending on your severity of your condition, these conditions, they give rise to hemolysis, the blood cell, so that is called hemolytic anemia. And also certain autoimmune conditions where your body reacts can cause destruction of the red blood cell and you have hemolysis. So that's another category.
Mm-hmm.
And now the important one, so we have to look at how do we approach a patient with anemia.
Right.
So the important one now we come to is loss of blood. So you're bleeding. Of course, you'll get anemic. So you're losing the blood. Now, normally, if a patient comes into you, so let us see, if you're healthy, nothing's wrong with you in terms of other symptoms. You just had a blood test, and the doctor said, right, your blood count is a little bit low. How do we approach that? The first thing I would want to know, I would want to check your iron, your vitamin B12, and your folic acid. So I want to know if you have the low ingredients for the production.
Right, right.
So when they look at those markers, if everything else is normal, I can say, fine, this person is not bleeding, or meaning they're not bleeding long term, because when you bleed long term, the iron would be low. If you bleed right away, your iron, when you check the blood, you may not see that because you have an acute bleed. So the blood volume just shrink. Now, you look at the vitamin B12 and all of that. And if you look at the blood cells and you see, okay, one cell is in the blood count, you see that the white cell is very, very high and the red cell is low, you're thinking, hey, something is wrong with the bone marrow. It is infiltrated by some extra cells, so you can't produce enough red blood cell. But if your iron is low, so the type of anemia that causes blood loss, we call it microcytic anemia. So when we talk about microcytic, macrocytic, and normocytic, it has to do with the size of the red blood cell.
Okay.
So if they're small, it's called microcytic. If they are normal, it's normocytic. And if they're enlarged, we call that megaloblastic anemia.
Okay.
So they are large blood cells. Microcytic, macrocytic, and megaloblastic, right? Okay, so the other thing I wanted to... Okay, go ahead. You were going to ask...
Yeah, I was going to ask you, look, in the interest of time, we have to look at it. But I want to ask, I've heard about sickle cell before, sickle cell disease. And in the shortest way possible, Doc, I would like to know if you can zoom in a little bit on sickle cell. Tell us a little bit more about sickle cell. And also, what are some of the, general symptoms associated with anemia, but also what are some of the major symptoms associated with something like sickle cell? Because that's zoning on one.
Sure. Yeah. I mean, of course, when anemia, today's subject, we were going to talk broadly on anemia.
Right.
So people understand what is anemia. And then, of course, we can zoom in on one and talk sickle cell thalassemia. They're common forms of genetic anemia.
Mm-hmm.
So in sickle cell anemia, so the blood cell, they're supposed to have a certain shape.
Right.
And in sickle cell anemia, due to genetic factors, so factors in the body, the blood cell, they sickle when there is low oxygen.
Oh.
So they get deformed.
Mm-hmm.
They have a different shape. Now these blood cells, they clump together and they cause blockage of the flow of blood. So this is a problem with sickle cell patients. And so you have you can have a trait of sickle cell, which most of the time you probably wouldn't have any symptoms unless you're going into condition where there's low oxygen, because these sickling happen in low oxygen. So or things like dehydration, different illness. When you're ill, mm-hmm. your body, you can go into sickle cell crisis. And that is when because the shape of the blood cell, they clump together, they cause blockage of the flow of blood. So what tends to happen, the sickle cell now, these abnormal cells. So sickle cell is a genetic condition where there is abnormality of the shape and size of the blood cell. In layman's term, right? So
Right.
you understand that. So you're born with a condition where the blood cells are different size and shape, and when there is low oxygen, they come together and they form the sickle, like they get clustered together, and they form a blockage to your blood vessel.
Wow.
So the blood can't flow. Normally the blood maneuvers its way into the blood vessel,
Right.
and it flows smoothly. So it carries oxygen through the blood vessel. But think about if the cells clump up together, you have an obstruction. So
Indeed.
it cannot flow. So what tends to happen? You can have obstruction in any part of the body. So it can obstruct in the kidney. It blocks the flow of blood in the kidney. You can have kidney disorder. It can block the flow of blood that going through the muscles, blood that going through the brain, blood that going through the heart, the lungs, and the bone pain. Lots of patients with sickling, they complain with severe pain. That's where they come in, they have a sickling crisis. And of course, you have to rehydrate them, you give them pain relief, you know, all of that.
All right, Doc.
So that is your thing.
We have about 10 minutes.
Summary.
We have about 10 minutes more for this segment. I'd like to do, if you can do 5 minutes of what are some of the symptoms, what should people be looking out for, why should they be concerned, and probably talk about some treatment. Please.
Yeah, okay, fine. So the symptoms, you can have anemia as a result of, the symptoms you'll get, as I say, if you have low oxygen in your body, you can get generic symptoms due to poor oxygenation. So what do? You get shortness of breath. If you don't have enough oxygen, you get shortness of breath. You feel fatigue. You feel tired. Now, if patients have conditions, let's say you are already a heart patient, you don't want your oxygen to go low because that will trigger a heart attack.
Yes.
But it do. If you have a lung problem and your oxygen maintaining at a certain level and it goes a little bit low, you can have shortness of breath and lung condition get worse. So your lung condition can get worse, your heart condition can get worse. You feel fatigued and tired. So most women, for instance, when they're bleeding, they have low blood count, they will tell you they're tired and fatigued, they could get hair loss. And depending on the type of anemia, you can have other signs in the body. So if you look for signs of anemia, you normally look at the mucous membrane under the eye.
Yes.
Right? So when you pull your eye down like that, if that's pink, if it is pale, it will tell you. If it's pale, we'd say, hey, this person look anemic. As you go down we normally would feel the neck if there are swollen glands, because if you find swollen lymph node, that could be a condition where there's abnormality of the white blood cell, and that can damage the red blood cell. So you get too much white blood cell in the marrow, you get less production of red blood cell, so you want to feel for glands. So these are some of the things you look for. Swollen glands. You come into the body now, you want to feel for your liver. In certain types of anemia, you can have enlarged liver. So especially the ones where you are born with, you can have enlarged liver, enlarged spleen. So those are the typical symptoms. You can have anemia where you have aches and pains in your muscle. So children will come with this and they say they walk in and they have aches and pain in their muscles, and when you check them, they're anemic. So those are your classical symptoms. So depending on the type of anemia, you will get those symptoms. Now, quickly, this is a very important one when we see a patient with anemia. The ones that are genetic, like your sickle cell and your thalassemia, they are the ones that you tend to get from childhood, and lots of times it's diagnosed and you know. The decreased production you can get if you have an infection or a bone marrow problem, and usually you'll know that as well. But the one that we are worried about generally is when you're losing blood. Now, lots of patients are losing blood, and we don't know where it's coming from. So what you have to do, you have to go looking for causes. So if somebody coming with anemia, you want to ask them, are you bleeding? Obvious thing, they will say, no, I don't know.
Right.
So what we look for something called occult blood, is hidden blood. So you'd want to check their stool, because where do you get hidden blood? So you can bleed in the stomach, and the blood by the time it get digested, it comes out and mixed with the stool. You don't see blood.
Right.
When you see bright red blood, you know that blood is from a blood vessel at the bottom.
Lower, yes.
But if you bleed in the stomach and the intestine, by the time the blood reaches out, it's digested and your stool might be black.
Right.
So you don't see blood. You don't know what is that. So we look for blood in the stool by doing a test. It's called fecal occult blood test, or FIT test, fecal immunochemical test. So they are poo tests. And when we look for one patient, if we find somebody that's anemic with low iron, we always check their bowel for cancer.
Wow.
So we do a stool test, because if you're bleeding
Right.
and you're from your bowel and the stool test is positive, you're anemic, you should have a camera in your bowel to look for cancer. Almost always we'll do that. That's one of the, that's an indication for searching for cancer of the bowel. Anyone with anemia, low iron, and there is positive blood in the stool, you should always look for bowel cancer. Now, so that's an occult blood. So where else can you bleed? You can bleed from the urinary system. So you can bleed from the urine. So if you have bladder cancer or kidney cancer, you can have hidden blood passing through. So anybody that is anemic, you want to check their urine if there's blood. So the idea there is that you're going to look for hidden blood, and then that will tell you the source of the blood loss. So this is a special type of anemia we call blood loss anemia. So I just said to you, production, destruction, and blood loss.
Yes.
So the one that we are more interested in, the others, the production and the hemolysis one, you will pick that up in different, either in a younger age or patients who are very ill. Whereas these blood loss type can be hidden. So you look for the other cause would be, so urinary tract system. So you'll check the urine. Third cause in women is gynecologic causes, the uterus. So women who have heavy period, which can be normal due to hormonal imbalance, they usually are, they're anemic. And then, however, we want to make sure if you're bleeding, irregular bleeding, we want to check the lining of the womb to see that you don't have cancer of the womb, because that will cause heavier bleeding, irregular bleeding. It gives rise to anemia. Patients with fibroids, if you have fibroids, you get heavier period, you bleed excessively, you get anemic. So you want to do that. So if somebody has got anemia and they have irregular period, painful period, you don't want to do a scan of their pelvis. So the abdomen, you do a scan to check their uterus, you check the lining if it is too thick, and you check for fibroids. And so based on what you're looking for, you test for different things, searching for the anemia, and based on what you find, then you treat it accordingly. But in terms of management, clearly, for anemia, depending on the cause, you try to manage. So the ones with production and blood loss, not blood loss, production and hemolysis, destruction, you find those causes and you treat it. So if you have infection, autoimmune disease, whatever it is, you treat those. But the one for blood loss, you investigate to rule out cancer. And of course, what you want to do, you want to give iron supplement, or if it is so low that iron takes time to build red blood cell. So if your anemia is very, very low, we would say, fine, have a blood transfusion, have some extra blood in the body because your blood count is very low. So patients who are dizzy, when they get up, they can faint, they feel they're very symptomatic, you would want to transfuse them with blood so that immediately they get relief.
Right.
Whereas patients who are not so ill, they can wait for a couple of weeks, you can give them iron supplement, because the iron, provided everything else is normal, you know that they're losing blood, they're not having enough iron, and you can also have low iron if you're not eating, like vegetarian. Or if you've got a stomach problem, if you have malabsorption, you can have all the components that are needed to make red blood cell. You can have problem with digestive system that you're not absorbing those nutrients. So iron supplement would be the thing. And in iron supplements, I would tell patients, don't use tea or coffee when you're taking iron supplements. It decreases the absorption. And you can use vitamin C supplement, orange juice or vitamin C tablets to enhance absorption. So it improves the absorption.
Right. Before we go, Doc, because we're coming down to the end of this segment, let me ask you this. If you were to recommend a daily dosage of something in our normal diets to help, keep us above, keep us going and make sure that we don't, even if we don't have signs of anemia. What would you recommend to have in our daily diets that can help in this
All right.
situation?
If women who are menstruating, I would advise iron supplement regularly.
Mm-hmm.
And it doesn't have to be every day. It could be twice a week, every other day. There is some theory and some studies have shown that your body absorbs how much it needs. So if you use every day and your body doesn't need it, you
Pass it out.
excrete it.
Mm-hmm.
Right. So whereas, and sometimes you get better absorption if you do it like once a week. There are some studies show that once a week give you better absorption, or every other day, alternate days, and things like that. So yes, what that is. Men are not supposed to be low in iron because iron is not destroyed. The iron is recycled in the body.
Okay.
So if a man is low in iron, I'm going to look for the cause. I'm looking for cancer. I'm looking for where is he bleeding? It's so important his body is bleeding, or he's not having enough iron. So if somebody is low, let us not confuse low iron with anemia, right? If you have low iron can cause anemia, but they're two different things. So if somebody says you have low iron, you can have low iron but normal hemoglobin.
Right.
It is only when it is so low for a long period, then it affects the production of the red blood cell.
All right.
So
All right,
a
Doc.
supplement, really, one supplement, I wouldn't say you need iron supplement on a regular basis. No, because why do you need iron if your diet is good and your system is working well? If you find that you have to have iron, we go looking for the cause. But I would prefer somebody to take multivitamin that has got a little of everything rather than taking one particular vitamin.
Yeah. What about some nice edo bhaji with edo leaf
Well, we
bhaji with
always
shrimp and so on,
advocate.
right? Because those things are very high in iron.
Yeah, we always advocate dietary means. That's
Yeah.
the first thing. If you have natural dietary food to provide the nutrients, that is always the best. It helps the digestive system and it gives you better results.
All right, Dr. Saw. Thank you so much. We're gonna close off this segment, and then we're gonna deal with the questions from last week in the next segment. Thank you, viewers, for joining us for this first segment. See you in a few.
Thank you. Take care, Akash. Bye.
Yeah. Hello, viewers. Welcome back. We will now be dealing with your questions from last week, and we urge you to continue to send in your questions. It doesn't matter what the topic is tonight. We're talking about anemia, of course, but whatever topic you want, whatever ailment or health condition you want to ask about, you can send in your questions. So, Doc, I have a few questions. Some of them are not questions, comments, but I find them interesting that we should raise them here.
No, absolutely.
Yeah. The first question here, Doc, is, Doc, does smoking weed cause headache?
Yes, I would say, okay, we can generalize and
Right.
to say smoking weed, will cause headache. I don't think I can say that. I don't have the evidence for that. I haven't, off my head, I would say, looking at the mechanism of the chemical that is involved, THC, cannabinoids, they stimulate certain receptors in the brain, and they can cause change in your neurotransmission, the chemical in your brain. That's the whole idea of the effects of marijuana, right? They have cannabinoids receptors in the body and all these things. So there's a chemical process that is happening, and of course that can trigger some sensitivity in the brain that can give rise to headache. So for sure, like alcohol, you can have drug use, any form of medication, drug, tablets, whatever. Once there is some chemical effect that changes in the body, you can have it can contribute to headache. So my answer to that it can cause headache, but not in all cases. And yeah, so that would probably be it. I don't know how else.
Some people
I don't have
may
lots of experience in that.
some people may say, when I get a headache, this is the only thing I can do. I mean, you know,
I take it on a split.
yeah, that's right. Man said, "By me neighbor, they say, I go get a spliff because me a rotten." So I mean, that's just little banter, but I understand what you're saying. But and there can be these kind of effects from many other things that we can use, in our daily lives.
Yeah.
Next question, Doc. Doc, is capadula bark good for back pain? Well, I want to know this myself.
Well, I don't have evidence to make a pronouncement on back pain for capadula. I've heard of capadula being used for erectile conditions, and it helps erectile dysfunction. And as a matter of fact, I'm sure my friend would not mind me quoting a paper that was published. I don't know if I can get the evidence, but a friend of mine, Professor Suresh Narayan, he used to head IAST, Institute of Applied Science and Technology. They have done some work in studying Capadula.
Okay.
And the evidence, they have published it in journal on the effects of Capadula and enhance erectile function. So I'm sure I haven't gone through it in details to see the effects on that, but there are some positive outcomes for erectile dysfunction. However, I don't have evidence that I can quote offhand on the use in back pain.
Okay. Okay.
No.
All right. Great. Next question is, Dr. Saw, does MSG trigger migraine, monosodium glutamate?
Yes. The answer is it can again. MSG, of course, as you know. Well, you see, when
Locally, let me interject to say this, please. Sorry, Doc. MSG is also called Ajinomoto or Aji in Ghana, right? Yeah.
We used to traditionally cook a lot.
Yeah, man. Yeah, you gotta get a lot of Aji in the food, no?
Yeah. No, the thing about it, I think in small amounts in food, probably not, but some people can be more sensitive to it. But they say in high quantities, it can cause increased sensitivity to the neurovascular system in the brain. So, yes, there are some studies that have shown that it can be a trigger for migraine because it increases sensitivity in the neurovascular structures in the brain. So that is it. But I suppose small amounts, I don't know. I mean, they say the reason why fried rice tastes so good is because it's got MSG.
Yeah, that's right.
I don't know.
Yeah, that's what they say. All right. They say the magic is in the aji.
In the aji, yeah. But, no, indeed. But yeah, it can be a trigger.
All right. Next question, Doc, is well, this one is not yet a question. It was a comment there that I found interested. It says salinated water helps with migraine. Is this true?
In my opinion, probably not, because salinated water is actually salt water.
Right.
Or saline water,
Yeah,
right?
yeah.
So salinated water is salt water. The evidence for we know that in migraines, if you're dehydrated, you can get more migraines. Dehydration is a trigger for migraine. And it's a trigger for headaches generally. Even in alcohol hangover headache, dehydration does that. Now, if you're gonna so we agree hydration will help. That is water, ingestion of water. But ingesting salt water. So if you take salt water, you have to know the electrolyte balance of the water. Because if you have too much salt in the water, less salt, you can either dilute the blood too much or concentrate it too much in terms of the salt content, and that may be triggering for headaches. So I would not advise, I don't know the evidence to make a pronouncement in totality, but at the theoretical level, I would say to you that I have no evidence to think that salinated water abort or helps headache. I would think that normal hydration with normal water, not to get dehydrated, will help you. The thing about salt water, so we know if you're dehydrated, you can get saline infusion. So 0.9% saline, we call normal saline, and that is isotonic. I mean, it get equivalent electrolytes with it's isotonic to the blood, so it balances the blood electrolytes, right? So that wouldn't be too much. But if you have highly concentrated salt and you take it in the veins, that would be too strong for your veins sometimes, and it can cause problems. If you get too diluted and you take it directly into the blood, that can also cause some imbalance. But if you're talking about drinking these things now, if I drink salt water, that is not getting straight into my blood. It gets into the digestive system, it is digested, some of it gets absorbed, some of it gets different ways it goes. Gastrointestinal tract, it can be excreted, So there are all sort of things, but I don't know. I've never seen any medical evidence, as far as I know, to substantiate that.
Oh, all right, good. Could it be also, Doc, that some of these things, like some of these things, can be a sort of a placebo? Also, is it possible from your medical?
Definitely. We have established that migraines and lots of these headaches, they can be triggered by stress. There's a huge component like the tension headache, which can also have migrainous features. Stress is a big factor. Placebo effects can de-stress you in a way where you are convinced that this thing is helping you. And it creates that less anxiety and that relief that you get psychologically.
Because in your head, you know that you're going to get relief. So obviously you're going to...
Exactly, yes. Psychologically, you're not so, worried that something is going to... You know that I'm taking something for this. And like patients who get panic attack, for instance, I give them something called a pill in the pocket. So I give them low dose of this anxiolytic medication, and half of them never use it. They said that the mere fact that I have something in my pocket to know that I'm going to get a panic attack, it helps me.
Right.
So these are the psychological effects of medication, and how do you, So yeah, it's all usually the thought process, the brain. The brain controls a lot.
Yeah. So here's a question. When is it better to drink magnesium? Is night or morning?
Supplements.
Yeah.
Magnesium supplements, generally, we would advise it to be taken with food. Because magnesium can get gastrointestinal side effects. So you take it on an empty stomach, you can have more gastrointestinal side effects. And also the absorption is better, the bioavailability we call it. The absorption is better when it's taken with food. So I would say with your meals, that's your absorption. It doesn't matter what time of the day. I would just theorize on the absorption and the bioavailability with food.
All right, great. This is another comment that I found very interesting. It seems this one here also falls into the placebo, but you can tell me better. Cure for my headache, shower from head to toe, and it's gone.
I feel that is a type of, that's a therapy in its own. You need cold shower.
Right.
It can de-stress you. It can change your body temperature. And all these are factors: heat, overheat, exhaustion can change your balance of the chemical in the brain and do all these neurovascular effects it can have. So I would imagine a cold shower can help some patients. That probably, in terms of it's difficult sometimes when you have to answer these questions in a way where I always look for the science and the evidence.
Right.
When we make in a blanket recommendation, you have to have the science to back it up or the evidence to back it up.
Right.
Sometimes you don't have the evidence to back it up, and that is why we cannot wholesale it to everybody. So we would say, like some people, acupuncture for back pain is very much well published and say there are lots of evidence to say it helps maybe half or 3/4 of the patients. But we still know that not everybody will get help.
Right.
It wouldn't help everyone. And likewise, all these things like aromatherapy, sometimes we don't know the effects and we don't have the evidence. And I don't have the evidence off my head. Sometimes I can go and research the evidence. If somebody asks me a specific question, so Doc, have a look at the medical evidence, because we have journals and literature that I can go on to the literature search. I put out the question, and then they will feed you all the studies that have been done, and they would do a meta-analysis and combine the studies and give out a recommendation. Right.
This got a question. Well, this one here, this person is asking if cold weather triggers it too. And well, I know some people, when they go in the sun, they will get, as we mentioned last time, sometimes just going out in the sun, and the cold weather they're asking.
We know light as a trigger. So weather can also be a trigger. So yes, cold weather can trigger headache. Hot weather can trigger headache. We know that our body has got lots of receptors that the receptors pick up temperature. So we have temperature receptors, and then they go through the brain to be processed and create signals in the brain. So yeah, cold weather can trigger it. So weather is well established as a trigger for migraine.
All right, I'm going to put two together here. Oily foods can causes headache too, and then somebody is saying eating too much sweet can trigger headache.
So yeah, so sweet as a trigger, people talk about that. So there are certain food that trigger it. Oily food, possibly. I mean, these are all triggers that has been mentioned in literature.
Mm-hmm.
So when we look at all these triggers, food, temperature, your psychological state, all these things are well-established triggers. So yeah, eating sweet, I would say there are known triggers. But the point is, in patients who have that classic migraine, you may have migraine and you're eating sweet and it doesn't have any effect on you.
Right.
You may have migraine and you're living in the cold. You're living in, Alaska, and you're perfectly fine. And you go to Guyana and you get headaches because it's hot.
Yeah.
So the point is, it is difficult to pinpoint, but these are all valid points. And we don't know that when we say these triggers, they don't work for everybody. They are just triggers in some patients. And you and I would have to, for patients who are suffering from the condition, they would have to see what are their triggers and try to avoid those triggers.
Right.
And that's a way of managing their condition.
Last one here, Doc. Lack of sleep too.
Oh, 100%. That is well established. So diet, temperature, sleep. We know sleep, lack of sleep, exhaustion. They are well established trigger.
Right.
When you don't sleep, when I don't sleep for like a whole night, I get fuzzy in the head.
That's right.
You feel like you're floating. You feel, you have to at least get an hour or two.
Yeah.
And I'm accustomed over the years during my medical training. You are on call. You work all night sometimes, and you don't get enough sleep. And yeah, even if in those days, because I don't do calls or work in the nights these days. But in the old days when I used to do that, you function well. You get a couple hours, you manage to get a couple hours in the night. But yeah, now if I don't get that amount of sleep, I'll be, my head is fuzzy next day. And of course, it triggers headache.
The exuberance of youth, you you have it all at that time. Yeah, Doc, thank you so much for joining us tonight. Viewers, I want to thank you so much for joining us. Continue to send in your questions to us. As you always do, we're here to answer your questions and to bring to the fore this education process about health and wellness. And we really thank you so much for your continued support. We hope that you can share this information with your family and friends. Just share this on Facebook so that more people get to understand their bodies and what's happening with them. So again, thank you so much. Continue to send your questions. Whatever questions you've sent in tonight, we are going to be answering them next week. Doc, anything from you in closing?
No, thanks again, Akash, and for the viewers. Thanks for tuning in. And I think we're doing a fantastic job getting the message out there.
Indeed.
And maybe sometimes I feel I normally try to rush through things conscious of time. But generally, if viewers don't understand it as clear, I'll be more than happy to elaborate the following week if they were to say, fine, this point wasn't well articulated or I didn't get it clear. I would, love them to send some feedback on that. But yeah, indeed, thanks again, Akash and your team.
Right.
And thanks to the viewers.
Yes, and definitely, as Doc is saying, if whatever topic we're going through, like we went through this evening, we went through anemia. If you don't have clarity on anything, you can pop it in the comments, and next week we are going to surely deal with it for you. So again, viewers, thank you so much for joining. As I always, you've been seeing what's happening in the country with these accidents. Slow down. And as I always say, stay healthy. Have a good one, and see you next week on Tuesday at 8. Bye.